All right. Hello, everyone. My name's Dylan Sanchez. I'm a fourth year business administration major, and I'm doing my presentation on malaria. So, what is exactly is the public health problem? Well, in 2016, 445,000 people died of malaria, and 216 million were infected. That's a pretty enormous number to be affected by a disease that we actually know how to control. But how exactly is that disease contracted? Well, mosquito bites are the mostly responsible for transmission of the parasite. The name of the parasite is Plasmodium falciparum, and it can be seen in the purple picture right next to this. This is the most common species that actually causes death or severe malaria. There are a couple others that I'll discuss a little bit later, but for the most part, this is the one that kills people. Now, where exactly does this happen? It mostly occurs in tropical and subtropical areas of the world, specifically sub-Saharan Africa. As can be seen in this map right here, it kind of shows a gradient of where exactly the most infections end up happening. It's the leading cause of death in many developing countries, and almost 50% of the world's population lives in an area that's at risk of being infected. Um, weather, tran- com- weather conditions allow transmission to happen almost the entire year. And the people here generally have a lack of resources and have poor conditions that make it very difficult to control. So what are the etiological factors? You can develop immunity, but young children and pregnant women are actually more vulnerable just because their immune system is affected by the pregnancy. Um, Poor neighborhoods are especially at risk because they just don't have the resources to handle it. There's actually 40 different female Anopheles mosquitoes that can carry the disease, and 5 species of the Plasmodium that actually cause the disease. What are some of the risks for the community in the future? Well, the biggest impact is economical, and the tolls can be actually very high on the families as well as the government around them. Infected individuals are generally poor, so purchasing drugs, traveling to clinics, lost days at work and school, and even expenses for burial really dig deep into the pockets of these people, even more than in economically thriving countries. Now I'm going to get into how exactly can we solve the public health problem. Um, First, I just want to note that the goal of most programs right now is simply to reduce the number of malaria-related cases and deaths. Elimination would only be possible if we can remove malaria from the entire natural world. So they actually have about 4 strategies right now. I'm only going to go into 2 of them. The first strategy, which is kind of just physical in the location, is insecticide treated bed nets. These bed nets protect the people from sleeping under them, but if they're treated with insecticides, they actually kill and repel the mosquitoes, just like bug spray that you would use if you went out camping. If more than 50% of the community uses the nets, then the mosquitoes actually have a shortened lifespan as well as the population is reduced. So this can help the entire community to actually get rid of the mosquitoes that are causing the problem in the first place. And then the second strategy is intermittent preventative treatment of malaria in pregnant women. So like I mentioned before, pregnant women are actually a little bit more prone just because of their immune system. So IPTP involves giving a curative dose of sulfadoxine pyrimethamine, and this is actually what prevents the disease from becoming deadly or even like very sickening. So even if the pregnant woman doesn't have malaria and they haven't been tested, they are given this just to make sure that they don't actually get any symptoms. On top of this, folic acid needs to be reduced because the effects of it tend to actually counteract the anti-malarial drugs. Um, so now I'm going to get into how the problem has been solved in a few other countries. The first country that has actually solved the problem was the US, and in 1947, they started spraying DDT all on the inside of rural homes as well as on the entire premises wherever they knew that malaria was prevalent. Um, on top of that, mosquito breeding sites were drained and removed, and we were able to actually successfully eliminate malaria from like basically the entire United States. Armenia also solved the problem, and this country focused on training staff, educating the population, and maintaining stock of anti-malarial agents. They also worked with neighboring countries to increase effectiveness. So looking into the future, how can we prevent this problem from occurring again? Well, we haven't completely eliminated it, but scaling up our already effective, safe, and proven methods of prevention and control is the only way that we will actually be able to make an impact. And this is only possible with the support and commitment of all countries and nations affected. Um, in my personal opinion, I think that now that we know exactly what causes it and how to prevent it, we need to focus on bringing awareness to Western countries that are less affected by it in order to start raising money in order to support the countries that are affected by it. If nothing's done, the toll that this can have on these countries is enormous, and we should definitely just try to help them out. Thank you. That's my presentation, and these are my references.